just a construct about how can we look at the depth of relationship.
People with intellectual disability had requested this to be put in themselves.
We did focus groups with service users, disability service staff and family members, and all of those groups were anxious about retirement and perceived it as...
Research has to guide our knowledge and practice.
One of the major issues for the adult community for persons with intellectual disabilities is poverty.
States, local governments, the federal government is feeling the pressure to reassess what they're investing in.
Science.
Families are relentless when trying to find solutions for their family members with intellectual disabilities.
Now, siblings both provide support, but they also need support.
So part of the problem here is that there are not that many established methods for designing environmental systems.
If we compare people who are poor, and people with disabilities are primarily poor, the rate of obesity is actually lower.
There's a very small sample in self-efficacy and hydration knowledge. This is for the...
The choice questionnaire largely has objective items that ask about the choices that people take, not about whether they're satisfied with how much choice they get.
We need to engage with in seeking information direct from people with intellectual disability.
We've done an enormous amount of work over the last 2 decades.
30 states projected or have already addressed $54 billion in projected shortfalls for 2013.
Instituted a bunch of initiatives, and we are collecting NCI data.
The numbers have been dwindling pretty significantly, all the way going back to the 1960s.
Culture has a major impact on self-determination in the way it's expressed.
Frankly, there's a lot of confusion about what you mean when you talk about self-determination in the field of intellectual and developmental disabilities.
How absolutely important it is to move from those general ideas in policy to the actual practice.
There's a conflict there between the context in which we're looking to monitor change and some of the basic characteristics of hedonic measures of well-being.
It's important to make that conceptual separation between the freedom to decide your functioning and what that functioning is.